Welcome this evening. I'm so glad that you came out in this really nasty old weather to talk about autism, and I'm glad to have you here tonight. And for coming out, I'm going to start out with something that most people don't know about me. I'm Tina Stassen-Head. One, I'm from Indiana. I'm an alien. The other thing is I brought my husband, mother-in-law, but I do have a lot of experience with folks with disabilities. My 32-year-old daughter was born with spina bifida, and how many of you know what spina bifida is? Okay, and she uses a wheelchair, she's independent, she lives in Utah, and is doing great. My children's father of married 29 years, has Asperger's. So I guess I'm keeping it all in the family, and have a long history of working with folks with all kinds of issues. So that's why I ended up being a psychologist. Okay, so when you have questions, please write them down, because they're gonna run the questions up to me, otherwise I won't be able to hear them in the back. Feel free to write those down as you're thinking, because I'm going to take questions at the end. Okay? All right. I'm going to quickly go through diagnostic issues, because most people coming, their children have been diagnosed. Here's the psychology speak, and this is really what we see. Oh, yeah, we got a pointer. For kids who are on the spectrum. One-sided or absence of interactions. It looks like they don't want to interact, but actually there's neurological things going on, and you can see them not interacting well with other kids or adults. They're very literal, concrete thinkers. A lot of them have that monotone voice. They are the walking encyclopedias. And 60 to 90% of our communication is nonverbal. And when you have trouble reading nonverbal, or you don't understand nonverbal communication, you're missing out on 60, 90% of what's going on with communication. Friendships are difficult. It's a lot of work to be a friend of the kid with autism. Some kids with autism are okay without friends. See where I go? Okay. And some of the things with autism, you get the stereotypical movement. A lot of kids will just line up their toys. It fascinates them. There's something visual that they like about that, watching parts spin. Some kids will repeat things. They'll repeat what you say, which is called parroting. Meltdown, this is the most common thing I see kids for, the meltdowns. And many times the meltdowns are because there's changes and they don't like change. I mean, things that are the same and routine are easier. They're lower stress, and kids know it. For those that we used to call having Asperger's, they can be an expert. And I see parents of a couple experts in here tonight. And they really are little experts on them. When I was in internship, I went to the home of a young boy who's in the house and outside put water pipes together in all different kinds of ways, and they worked. I mean, he's just amazing, and he was 7 years old. So they can be very specialized in what they learn. And most of the kids have sensory processing issues and ADHD. All right. There's been a recent change in the diagnosis. Asperger's, what we used to call PDD, NOS, pervasive developmental disorder, NOS, are now all on the autism spectrum. There is a new diagnosis where it's just that difficulty understanding the social communication, really having trouble learning it. Somebody that I'm going to be talking a little bit about, and I've got a video, Temple Grandin, she is not, she has autism, and I'm going to talk a little bit more about her. She says this is a problem the way that we are diagnosing and labeling right now. Nobody has social pragmatic communication disorder because there's no funding. It's one thing you will hear her say. The other thing that she has the most problem with is that people on the spectrum are so far functionally very high and very low. So it is a neurological issue. The brain's ability to change, remodel, and reorganize, and adapt. Even kids with autism, they do have neuroplasticity, but it is more difficult. It takes more repeated work with the child to get some changes going on. But that's what we work with because we really can over time. You can see the kids when parents and teachers start working with them when they're very young. When they're teenagers, you can see a huge difference in the issues that are going on in that child's life. Yeah. So what does this mean? It means that, you know, if you come in to therapy for an hour and you go see Erica for medicine once a month, really the people who are going to make that huge difference in your child's life is you. Absolutely, there's no question. What I do is just help parents do the best they can. And I'm going to talk about some of the most common things that I work with in therapy and with parents and the children. And here's the other major primary agent of change, of course, is at school, and the teachers with the school, and the teacher's aide, and everyone, and the principal. All the people who are in that child's life are primary agents of change. And what we do, I'm behaviorally trained. Western Michigan University is one of the main behavioral universities teaching interventions and all that fun stuff. So this is what I focus on because we know this is what is effective for children with autism. I work with the family to develop effective interventions and strategies, and it's up to the parents to apply those consistently. If there's one thing that I would get every parent to understand is this is critical. It's vital that the interventions you're doing at home, whatever you've chosen to focus on first, you're consistent with that. So we know autism isn't an excuse, but today we're going to talk a lot about understanding autism. And what do you do when something is so different? It seems like it's an excuse for poor behavior. So we are going to talk about what you do about that balance between having an excuse and then working with the child. So this is the thing that stands out most with the kids with autism. They don't have social skills, and it's up to us to give them feedback, to work with it. Doesn't mean we have to be mad at them, frustrated, although it can be very frustrating. This is Temple Grandin again, and her having autism. Then I really accept that she said it's not a free pass. We have to work, and one of the things she will explain in the video clip is how she worked so that she functions better and better throughout her lifetime. And this is hard. Have you ever told a kid they can't do what they want to do who's on the spectrum? Yeah, they hear it next door in my office sometimes. All right, so we're going to start with interventions, the ABCs of behavior. Antecedents are things that happen before. We call them a trigger. Of course, we've got the behavior, and then the consequence. When we say consequence, parents think of the discipline, the punishment. When a behaviorist says consequence, we're really saying the outcome of the behavior that affects that child's behavior in the future when the trigger is present. Okay, and I'm going to explain more. All right, this is my famous stoplight scenario. All right, you're coming up, you're driving your car and you're coming up to a yellow light, turning red. What do? Well, if you hit the brakes, a couple things can happen. Nothing eventful, everything's fine, and that reinforces stopping at stoplights in the future in the presence of the yellow light turning red. Or if you're rear-ended, that will decrease stopping. You're likely to go through that yellow light turning red if you've been rear-ended in your lifetime. So you're looking at a consequence is affecting future behavior given that antecedent. But what if you hit the accelerator? Okay? So again, these are the three outcomes. We've got nothing eventful, which is reinforcing, going through. How often do we go right through the light? I never do. If we have an accident, okay, that will decrease going through the light or get a ticket. Okay, so these are affecting that, and they're positive and negative issues that happen to influence that behavior. All right, I'm going to talk a little bit about Temple Grandin. She's 70 years old now. How many of you have heard of her? She's pretty well known. Okay, about half the room. So she didn't start talking till age 3.5. She's classically autistic. This woman has a doctorate in, let's see, it was animal science. And she's got a phenomenal story. There is a movie about her. And maybe you guys have seen the movie, Temple Grandin. The issues that this woman went through, she did have a wealthy family that could afford to give her speech when she was young on a daily basis in her home. And then they started, at age 3, they focused on social skills. So her parents could afford to bring in therapists for her. And this impacted her life quite positively. And she did find friends during special events like horseback riding, sports. And it's a phenomenal movie if you care to see that. She has her own business. She created the machine for cattle that hugs the cattle and it relaxes them when they need to get a vaccine, shot, and other work done on them. So she's impacted the humane treatment of animals in Canada, the US, and around the world, actually. All right, so I'm going to play a 7-minute clip, and you can see her views on autism and kids with autism.
Dr. Grandin, what is it like for you personally to have become the most celebrated person in the field of autism?
Well, I feel it's a responsibility. I get a lot of emails and letters from young kids. In fact, at the last conference I was at, I got a whole envelope of letters from kids in an English class. What makes me pleased is I think I'm inspiring a lot of kids to succeed, because I want to see kids succeed. Now, one problem I'm seeing with some of the fully verbal kids is they're not getting stretched enough. I see kids coming up to me at conferences where nobody's taught them how to shake hands. See, when I was a young child, I had to be party host at my mother's parties. I had to shake hands, say please and thank you, have table manners, learn how to shop. And I'm seeing too many situations where they aren't learning those basic skills.
Yeah, so you really think they need the basic skills that every child should learn?
Yes. Now, in the 50s, every child was taught social skills in a much more structured way. And today, that's not the case. Now, the so-called normal kids, they pick it up, but the autistic kids have got to be taught, and that's not being done enough.
What kind of preconceptions, though, do you think most people have about relating to those with ASD?
Autism is a really big spectrum. You're going all the way from Silicon Valley down to somebody with a lot of intellectual challenges. Now, the kinds of services and things a person needs is very different, those two ends of the spectrum. And I go to different places. I go to Silicon Valley, and I see a lot of people that I know are on the spectrum. And then I go see another kid that's smart at math, but nothing's being done to develop his skills, and he's getting addicted to video games. And they are the same kind of kid. The thing that I'm seeing, especially on the mild end of the spectrum, is too many kids sort of becoming the label. I'm very concerned about them getting a handicap mentality. Then I go over to the meatpacking plant, and there's a whole maintenance shop of old hippies that I know are on the spectrum, and they run that maintenance shop. And they've been there for years and years and years.
Why do you think the numbers, 1 in 68 now, have risen so dramatically?
I think on the mild end of the spectrum, it's increased detection. Because I can think of kids I went to elementary school with, kids I went to college with, that today would be diagnosed on the spectrum. I think that's a big part of it on the mild end of the spectrum. Now, I think there also is some severe autism that may have actually increased because there's more environmental contaminants, and there's more medications being given during early pregnancy.
Dr. Grandin, you beg parents not to let their children with autism be defined by the DSM or the Diagnostic and Statistical Manual of Mental Disorders. Why?
Well, I think the DSM made a big mistake removing Asperger syndrome, because under the DMS-4, autism you had to have speech delay, Asperger was no speech delay. Now, you could argue scientific reasons for taking out the speech delay stuff, but from a service provider standpoint, the kind of services that somebody's nonverbal has is different than a mild kid with Asperger's. And I'm seeing too many fully verbal kids, less severe than me, getting put into a class with nonverbal kids. I'm seeing too many smart kids not learning job skills. That's another thing that I really push. Because when I was 13, my mother had got me in a sewing job. When I was 15, I was cleaning horse stalls. It's really important that students intern in a job before they graduate from high school. They got to learn that discipline of getting to work.
If you could speak to every business owner in America, what would you say to convince them to hire somebody on the autism spectrum?
Well, there's certain things they can do extremely well. In fact, the SAP Corporation is hiring people with autism. There's another Project Search, where there's work being done with collaborating with hospitals to train them to set up surgical instruments for different types of surgery. And they take longer to train, but once they're trained, they're super, super good and meticulous about making sure the instruments are set up right. And that's got about a 78% employment rate.
So you think the skills that those with ASD have to offer are often overlooked by people that employ?
As I said before, I can think of kids that I went to college with that definitely were on the autism spectrum. Those individuals are all employed in good jobs. And I think a lot of this gets back to pounding those manners in the 50s and the 60s, and kids being on things like paper routes, where they learned work skills.
Why do you think the experts in the field of ASDs focus so intensely on the deficits and not on the strengths of autism?
Well, we need to be building up strengths. My ability in art was always encouraged. And I was encouraged to do lots of different kinds of art. If you got a third grader that's good at math, and he can do a high school math book, let him do the high school math book. Don't hold them back.
I want to know why you think that so little attention has been paid to the sensory processing issues. What can we learn from those?
Well, I just heard about a brand new study that's been done up at in California, Dr. Wu, and they took children aged 4 through 12 that had speech delay, and they stayed in their regular programs, ABA or whatever the speech therapy the school was doing, and then they got an hour a day of sensory therapy where they did a lot of variety of stimulation, like walk on different kinds of flooring, smell different smells, do different activities in a mirror, big variety, always doing more than one sensory thing at a time. And it was done as a controlled experiment, where half the kids just got the regular treatment and the other half got this added sensory treatment. And they got some really big, significant improvements. And they made the point of using all very inexpensive things that would be in any house.
There's so much division in the autism community. How do you think we can all come together and find a common ground?
I think that merging Asperger's together with autism has made all of this worse, because you have a segment of very, very severely handicapped kids where they're never going to be able to live independently. That's a very different kind of situation than a mild Asperger's type of kid. You see, you're putting too many apples and oranges together. Every other diagnosis, like dyslexia, learning problems, ADHD, you've got a fully verbal kid. Only in autism, Right now, you're getting a range going from, smart computer geek down to somebody who has very, very severe challenges. Now, I think the American Psychiatric Association originally figured the Asperger kids would get into this social communication category. That's not what's happening. Nobody's going into that because there's no funding for it.
As the most admired person in this field, and we are literally becoming an autism nation, what do you think the most important thing is for us to be aware of?
Well, there's a point where personality variants are just normal variation. I think a brain can be made more cognitive and thinking, or a brain can be made more social. Now, at what point does that become abnormal? There's no black and white dividing line. I'm getting concerned that what we're saying is abnormal is getting bigger and bigger and bigger. Obviously, a child that has severe speech delay, that's an abnormality. But when you take the kids that are just kind of socially awkward, a lot of those kids are really smart. And then you got the person that's a total social butterfly. And let's think back to the caveman days. I don't think the social yak-yaks around the campfire made the first stone spear.
Dr. Grandin, thank you for inspiring all of us as parents and children.
So, she has a lot to say, and you can see she's autistic. She's very unique. Her clothing style is her sense of style, but she also has a different cadence in her voice than most folks. I don't know if you noticed. She has very more flat tone of voice and way of speaking than most people do. But yet she's extremely bright, and I will say this, I've heard that when she gives presentations that in the past, if people were talking in the back, she called them out. So I won't do that here, but I won't channel Temple Graydon, so you guys are being a real good audience anyway. So, and she has said, the older I get, the less autistic I am, meaning she works on that throughout her lifetime. So, to cap, and you guys can take this home with you and your guidelines, high but reasonable expectations, that's stretching. Building on strengths. Now, she mentioned, and I don't know if it was in this one, but their addiction to video games. She has, and that is something that I am dealing with more and more in my office, because the video games are a distraction which can be used to prevent a meltdown, right? I mean, who wants your child screaming at the restaurant where it's supposed to be quiet? But what's happening is some of these kids are only finding stimulation and enjoyment when they're playing their video games. And so now they've got to be weaned off. Well, if they don't, that's all they're going to do the rest of their lives. And to wean them off of that when they don't like change and transition it's rough. It's really rough, and several folks are struggling with that right now. Of course, the social skills and parents giving feedback every day about your manners is vital, because that teaches them to get along with everybody else. We need to work more with sensory processing. I don't work much with that. I try and make that recommendations for school-based sensory diet menu where they have activities to choose from. It usually is very, very helpful. Got one boy with a swing in his home who can swing when he's distressed. And the other one she didn't have a chance to talk about a lot, and I'm going to talk about a little bit more, is anxiety. So this is from her book with Sean Barron, and the ones that are in highlights are the three that I work with most in therapy. Rules are not absolute. Rules are situation-based and people-based. That's a given, but kids on the spectrum think rules are absolute. You said this. You can't vary from it, and they are very distressed until they realize that rules are not absolute. Rules are situation-based and people-based, and I work a lot with my folks on that. Not everything is equally important in the grand scheme of things. You know, some kids If they didn't get the lunch they wanted, they'll have as big a meltdown as if they lost TV for a week, you know? So, everyone in the world makes mistakes. It doesn't have to ruin your day. Could all use that one. I do work a bit with this one. Honesty is different than diplomacy, because we have very frank, straightforward youngsters and brutally honest. So how do you work with kids about that brutal honesty? And that is, you start working with perspective taking, social skills, think about how the other person feels, and what do you say instead? Being polite is appropriate in any situation. Kids on the spectrum, most of them, most of them they're rude. We talk in social skills group about expected, unexpected behavior, and what unexpected behavior is basically rudeness. So they struggle with this. They struggle with being polite because they have difficulty with that perspective taking. Some kids, more than others, struggle with not everyone who's nice to me is my friend. Some kids, if you walk up and talk to them and you're not mean to them, they will call you their friend. And they have trouble differentiating, and they have to be taught who is a friend and who is not. People act differently in public than they do in private. A few kids struggle with that. Know when you're turning people off. So this gets to be some feedback in my office. Did you see my face when you did that? You know, that kind of thing. Having parents really give feedback. Did you notice that your brother, did you notice that your friend turned his head and stopped talking, or doesn't enjoy watching you play that video game for half an hour? Because they're not good at turn taking at all. Fitting in is often tied to looking and sounding like you fit in. This really comes into play during the teen years. Really work on that a lot. This is what we focus on often. And people are responsible for their own behavior. And that's really tough. And here's the reason why that's really tough for folks on the spectrum, or most of them, is because inside, most of them are very emotionally sensitive. And when I'm emotionally sensitive, I don't want to hear that I'm doing something negative, wrong, right? You know, it's hard. You have to have a level of maturity to say, yes, I did that. And that I spend a lot of time with this one. And just see, you're blaming this and that. And we really have to get folks taking responsibility for their behavior so they can change it. I do a lot of work. That's probably the one I do the most, I think. So, who should adapt? Us, them? People with autism think that they shouldn't have to adapt. That's one argument. Everybody else, you know, they are different. In quirky, fun, weird ways. They're interesting. They're just different. The goal is not to make a person with autism normal. And this is where I come from, or someone into who he is not, but to enhance his or her strengths and teach him to maneuver. Be aware of what other people think, and you'll go far. And there's that being responsible, talking a lot about personal responsibility, because if you don't take responsibility for not fitting in socially, Temple Grandin, you know, said it herself, you're not wanting to put that effort and that work in to do it. So she calls them out. It takes a lot of work to have social relationships and work skills. And I agree with her, it's not an excuse for not wanting to do the work that you need to do. And it is a lot of work. I'm not going to gloss over a lot of the work that's really helpful today. But I do have some references in the back. Hopefully we'll get some people on the track to really use some more of those. There's so much that can be done. And of course that's, I should have that on my wall. And emotions can be illogical. And to folks on the spectrum, many of them say emotions are illogical, or they let emotions make their choices for them. They make decisions with their emotions. This one, accept authority. And when kids are rigid, they think it's okay to argue with authority figures. Some situations might be unfair, but they need to learn. You don't argue with the cop, okay? You don't argue with the principal, okay? You just accept it. If it's unfair, let's do something later, okay? We want to work in ways to teach in ways that make sense to the child. I'm going to talk about some of those strategies that are available today, because we want to work with them and with their strengths, and really toward attaining emotional relatedness, and that's difficult. It's not necessarily, and this is something that folks say, it's not necessarily a prerequisite to being happy. Not everybody has to have that social relatedness and have friends. I have some folks with autism who are happy not having friends. And I'm not going to change that. And that's okay. But I'll tell you, one young man that I saw for years at the clinic, flat but on the spectrum, not interested in friends. He came in to say goodbye because he's 18 and aging out. He was polite. He made sure that he spoke to me, that he spoke to the other people in the office. He smiled, and he's enjoying his life. He doesn't want friends. He doesn't need close friends. But he is a well-adjusted person and is looking at, is he going to go to tech school or is he going to have a job? So, but I was very pleased to see this young man who really struggled, and a lot of the kids do, with the anger, aggression, meltdowns early in their life. Phenomenal. So what do you do? It's so hard. Perspective taking is hard. And we know that's seeing things from somebody else's point of view. So we have to teach them, we have to tell them other people think differently, feel differently than you do. They exist. They're sources of information. They're going to help us. Just because other people are around, we're interacting. We're like the puzzle pieces here. We're fitting together. We all have our piece and our part. But the kids need to know that, and that's the thing. They're taught step by step, overtly, instead of neurotypical kids pick up things just by being in a classroom, just by being home. And flexible thinking, ability to accept change, notice and consider alternatives for concrete situations. So when I have a couple teenagers that come in on the spectrum, and when they leave, I feel like I've gone like this for about 45 minutes because they're so rigid in their thinking. So the meltdowns are over by the teenage years, but if there's still that emotional sensitivity, they don't want to hear it. It's what I think and nothing else. And you can show it black and white and demonstrate, and no. It's rough. It's rough. So, a lot of parents want to know, what do we do for self-esteem? Well, Temple Grandin did things that were hard. We're not going to get self-esteem and build confidence by not putting in the hard work. The child has got to do some things that are challenging to feel good about themselves. And that's tough for a parent to watch. But we've got good parents. They're doing it. And that's self-explanatory. And kids, if they're getting excessive praise for expected behavior, they know. Motivation can be an extremely difficult thing. Cultivating interest in exploring the world. How are they going to do that if they're in the video games all the time? They're not. That's one reason that those video games, the time has got to be cut down so they're out exploring, so that they're doing activities, so that they're finding things in common with some other kids. Build on their interests. If they are struggling in math but they love dinosaurs, take dinosaurs and use them like blocks for practicing your math. And the teachers at school are pretty good with this. The difficult thing is if I'm interested in dinosaur and I have to write about frogs. That's the hard part. Yeah. Recommendation, use guideline instead of rule. If you've got a real concrete thinker, that might be something you can do. That's a good rule. Avoid using always and never, because that's hardly ever true. So if we think about it, social rules reduce our anxiety because it's somewhat structured. And if they're taught those social skills, their anxiety is going to go down because they know what to do. And that's why social skills are vital, part of the reason. For the classroom, if you're posting rules, do something so the child knows. If there's a fire, you don't follow that rule and all that kind of thing. Because they will, some of them. And check for understanding. That's a phenomenal way to communicate. Make sure. So what I hear you saying is, what did you hear me say? Little mantra. Every rule has an exception. And there's not going to be perfect consistency between home and school, parent to parent, but we can try. We can do some things to have more consistency on really important points. Children will adapt if one parent has a set of household rules and the other does not, but it's more difficult. And there's always variation between individuals as well. So black and white thinking. She believes, and I agree with her, that meltdowns are largely the result of trying to retain control over issues in her life. So we want to help them, develop problem-solving skills to realize they can handle a situation instead of melting down, and that's some of the things we work on in session. An example, Sean, do you remember Tinker Toys? Few people, Legos. We'll pretend it's Legos. Okay. So Sean, when he was young, and the neat thing about this book that I'm referring to here is that they look at how they were thinking as children, and then it really helps me understand how kids think and how far they can come with their thinking. So he recalled that when he was about 12, he did this elaborate Tinker Toy Lego airplane. Took his friend in his room, and as he walked back in the room, a blue piece was missing. and he had a meltdown because it never crossed his mind that he could just stick in the blue piece that was missing. Never crossed his mind. And he broke it, he had a meltdown, and he later realized his friend probably wouldn't even notice that one little part missing, but he couldn't handle it. So sometimes destructive behavior, which is hard to understand, they explain that he used to take things apart and throw them in his closet. He didn't, until later, explain to his parents he was putting them in the washing machine, which was his closet, and because he controlled that, he felt less anxious. So a lot of what the children are doing is to reduce their anxiety, but it looks puzzling to us because it wouldn't reduce my anxiety to throw things in a closet. So one thing, that we teach is distraction, hobbies, and that also can help when you're anxious, and we encourage that as well. Some kids will use conversation as a way to control the interaction. And notice here, they're not really looking for information, they think they have it all. Or they're trying to dominate the conversation and that's control. Let me tell you about this. So these are issues that we work with at certain periods in the child's life. And I recommend the book highly because it does help us get inside the mind of a child on the spectrum. One thing I teach a lot about anxiety, avoidance increases anxiety for anyone. The more you avoid it, the higher the anxiety goes. I teach CBT, and I'm going to show you in a minute a little bit about that. Another thing you can do, if something is very anxiety provoking, especially in school, you can modify the requirements to do it, but you don't let them off. They still need to do it. And that will be helpful. It stretches, that's stretching them. You're not forcing them to stand up and give a book report, but you modify that. Maybe the teacher and 2 kids are present when they stand and give a book report. And that requires the child to make effort, and you can feel good about that. This is my CBT. You ever hear that? He made me mad. You feel angry, and you yell. So we look at how much what we think affects our emotions, our behavior, and so on. We talk about, because you take responsibility, the other person didn't make you mad. You decided to be mad because you could decide not to be mad. And we can't help the auto thought that pops up, but you can say, I felt angry when he called me a freak. You can say that to yourself. I felt upset. Okay, yes, you did. No, that's a fact. And then maybe it's a little less frustrating or angry. And maybe I'm going to go to the cool down area instead of tossing a desk. Cool thoughts. I love them. They're immediate. They're automatic. When I have the kids, when they start feeling upset, even if they haven't identified their hot thought or their trigger, use your cool thoughts because it will bring your emotion down. Dr. Wu's study, I've got that listed in your guide. I'm not going to go over that, but it was very clear that the sensory processing group, and this actually is a very valid study. They had control group, and which means business as usual, and then the experimental group, and they compared and they did their statistics. This is a really good study. Not all studies can say what they say, but this is a good one. So, I'm going to skip down through this so you guys can read that, and I'm running out of time. So during social skills group at the clinic, we focus on, I use the Think Social protocol. I put the reference in the back. There are many ways: initiating communication, listening, abstract, inferential communication. That's hard, but there are things that we have set up to help teach that to the kids. Understanding others' perspectives. There's little skits. There are questions. There are quizzes, and a lot of discussion. You want to get the big picture about it, and that's what we talk about. Humor and social relatedness. Some kids have no humor, and they know they don't. They could be sad about it. These are other issues that this is the time we're really tackling some of those day-to-day social skills. Our behavior impacts how others react and respond to us. You know, unless we teach those ASD kids that they don't know this. We know it. They really don't know it. So, this is a social behavior map. It's one of the tools I use during group, and it's in your guide. But you can look for unexpected behaviors, what happens. We map these out, and the kids do that in the group. They really respond well to these. To be honest, you know, the thing that's the hardest is between group. You know, how parents can take what they know. I bring the parents in at the end. This is what we talked about today in social skills. The kids tell them, actually, they take turns saying, we learned this, we learned that. But the hardest thing is getting parents to practice that, or remembering in the moment to reinforce what they've learned. And it's just habit, and we don't think about it. But the parents who really think about it and really point those things out, the kids will make more progress. You know, so much. This is what I was talking about. There's so much to learn and teach. See? Pages. These are hours and hours of things to talk about. I'm going to touch on positive behavior supports. I have a printout from this in the back. I made a few. I've got the reference in there if you're interested in that. Basically, you start with the functional behavior assessment to figure out what the issue is, what's triggering the behavior, and then you identify things to help reduce the behavior. You don't remove the trigger completely, but you modify it so that it's manageable and the child begins to tolerate what it is that the trigger is. All right. You know, it talks about how the kids feel when they have those meltdowns. And they're in the back, these go into a lot of the specific ways to do this. Okay? And it's to reduce the meltdowns. Okay? Consistency, and by consistency I also mean that working on things between sessions. You know, we're reinforcing, we're working on that this week. All right, references and books for you guys. So I've got a couple folks that are going to pick up questions written down on your index cards. I'm not off to a good start. The first one's about medication, and I'm not a med person.
But I am.
But Erica is. So the issue is meds can help with a lot of the issues, and that's up to that side of the clinic. So, do you want to answer?
Sure.
That's medical marijuana, about seizure, on the second row.
what meds for anxiety can be given. So typically, that's one of the primary symptoms that we do treat when kids come to me with a diagnosis of autism spectrum. They usually have also a diagnosis of anxiety disorder, typically about 70% they're saying. So we use medications, antidepressants, typically, Zoloft being the most common, I would say, to treat anxiety symptoms. And then medical marijuana for seizures. I'm going to have to go ahead and say I don't know enough about that to give an answer for seizures, but definitely I would say following up with a neurologist and asking that question, because I don't treat seizures as a psychiatric nurse practitioner. That's not something that I do, but medication for anxiety is probably one of the most helpful things from a med standpoint. Once we've addressed the emotional meltdowns, the tantrums, if that's creating problems. If it's driven by anxiety, we treat the anxiety first. If it's not driven by anxiety, typically medications like Risperdal and Abilify are the only two actually FDA-approved medications that we use for behavioral meltdowns related to autism spectrum. So.
Okay. The discussion seems more about older child. What about early intervention? So early intervention can be extremely helpful, and it's highly recommended. Remember, I talked about Temple Grandin was getting speech, getting play therapy at age 3 and 4. There is research that shows the early intervention, the earlier you start with the therapy, the speech therapy, and whatever therapies the child needs, the better the outcome. Absolutely recommend early intervention. Most of the kids on the spectrum are identified and do have early intervention. Why more boys than girls? No idea. Genetics, don't know. More boys than girls with ADHD. Some disorders are 50-50. Don't know. I'm sorry. How important is the sensory input? Oh, the sensory diet to a child who might not have been diagnosed yet but exhibits sensory issues. That's a really good question. You can have sensory issues without being on the spectrum. You can have sensory issues with ADHD, with attention deficit hyperactivity disorder. The issue is you're treating something that's disrupting the child, dysregulating the child. It's vital, absolutely vital. Are there any sources geared toward nonverbal autism? There are. There are many folks that work with the nonverbal kids. I've worked with a few, with the communication box and things like that. I will be honest, most of those folks, you go to the ARC because their needs are better met by the ARC and the ARC clinic and programs. There are a lot of folks working with it. When someone is nonverbal, they're probably getting several kinds of support throughout their lifetime. Are there any programs in the community geared toward special need children? Yes. Somebody says Camp Hollis, yes. Not enough. There are lots of support programs. It sounds like, what do you do for the kids? There's very little that are direct services to the kids. The social skills group is one of those things that we offer, and not often enough. How do we get a pediatrician on board with a parent who suspects mild ASD? Oh, got to be tested. Yes, you can go. In the end, okay, here we go. I knew there were going to be diagnostic ones coming up. Okay, so at the very last page, of course, we're here. All of these do diagnosis and treatment. The issue is, you see where they are? They're not in Oswego County. We're the only one in Oswego County. I'm the only one diagnosing autism right now, because that's a psychologist's job to do.
Where are you located?
Pardon?
Where are you located?
Child and Family Services in Fulton. I don't do testing for people come in just for testing only. At our clinic, if they need testing, I will do that, and then it's part of the treatment process. You can go to Margaret Williams. I mean, they're waitlisted, and you can get a diagnosis and then find people in the community for treatment and take that to the school as well. But out of that evaluation comes a lot of recommendation, and they're pretty time intensive to do that. Yes, you can, and you should go to a specialist and get it just settled. I get a lot of consults for thinking folks are on the spectrum, and I think about half. I'm like, this is selective mutism, this is ADHD only, little social skills problem, and then the others then are further tested to confirm that. And there's times they come in and I go, yep, you got no need to test. It's so obvious, yeah. So people who are at the clinic and admitted there, that's part of what our services include. Uh-oh. You're on, it's a medication one again. All right. I'll give it to you in a minute. What's the conclusion regarding, regarding the vaccines causing autism? Research finally answered the question. It doesn't. They finally ruled that out, that vaccines cause autism. In severe cases, what type of respite's available for nonverbal? That's heartbreaking. I don't know of any. I'm sorry. We don't have enough programs and services. I have kids who can't get respite just because they're too aggressive or having too many meltdowns. And so you've got there may be places that you can find with the respite program.
Is going to be the best place to look.
Yeah.
Where?
The ARC.
ARC.
To get linked up with respite
Yeah.
services.
Because they've got the connection with that. How early can you diagnose?
I know she had 4 up there.
4 to 18 are the ages of children in our clinic.
Oh, okay.
And we try not to take 4-year-olds. But, we do some, we have a few. A good solid diagnosis is around age 7. But that doesn't mean you don't treat all the issues beforehand. And you can get a real good idea. People that do developmental research found certain behaviors are very indicative of autism. And there's a video online about this study, but I don't know if you've seen it. They brought in typically developing kids and kids they think are on the spectrum, and they put whipped cream in their hand. And a typically developing kid goes, look, isn't that the weirdest thing? You can see that in their face. They're not saying that. I mean, they're about a year, 2 years old. And the kids with autism just get drawn into this weird thing in their hand. They don't reach out to share that. And it's an indicator. But you can see early signs. Anybody else? Oh. What role can diet play in autism? Chemicals, food dyes, processed foods. Well, I know that's a huge issue in the autism community. And honestly, research doesn't back up most of the dyes, the sugar, it just doesn't. And it's hard for parents. Now, there are some parents that swear, when my child eats sugar, they're off the wall. Okay, don't feed them sugar. That's okay. We're good with that, okay? But as far as healthy diets are good for everybody. You want your child to be healthy, have exercise, because when we feel healthy, we can handle our emotions better. All right, any other questions?
Is that in the way?
Thank you. Oh, there was one more?
No, that was
Nope.
the
Oh,
medication.
the one on medicine. All right. Hold on. Here we go. The top one. It's the top one. PRN meds.
Circumstantial.
So PRN, typically in kids, are we talking kids only? So
Around 18-year-old severe.
So, I mean, PRN medications, it depends on the severity, obviously. So hydroxyzine, which, can be used for anxiety symptoms, help calm down agitation. It's probably the most similar to Benadryl.
Hydroxyzine, that's the generic, what's the trade name?
Visceral.
Visceral.
Yep, so typically that's what we would start with, and then from there, obviously, moving, depending on the severity of the anxiety, you can use, and depending on seizure disorder and things like that.
I'm
yeah.
talking about circumstantial, a child that reacts to certain circumstances, gets very agitated or non-compliant. If you could give something on a short term, just PRN.
PRN, so,
Yeah.
visceral hydroxyzine tends to be the most benign, the safest medication of choice. And then from there, obviously, depending on the severity of anxiety, Klonopin, Xanax also. Sometimes PRN Risperdal can be helpful for those behavioral moments, because that also can calm down some of the agitation and irritability. Sometimes PRN Risperdal, but I would give the melt-away tabs if you're giving it as a PRN medication. We typically would give the melt-away version.
Not long-term effects, it would just be a temporary.
It would be a temporary PRN. Risperdal can be helpful too. Not necessarily targeting the anxiety, but more the agitation and irritability that comes with that, change or, but specifically case by case as far as medication, that's a general overview for anxiety. As needed, we use hydroxyzine or the benzodiazepines, Xanax, Klonopin,
Xanax, yeah.
Ativan. And then behavioral issues, PRN, Risperdal tends to be the most common.
Okay, last question is how to get a kid on the spectrum to eat. Well, it's extremely hard. I do work with several kids, trying to get them more variety. I think it comes down to this. I think mom and dad have to say, you will eat a bite of that with your meal. I think that's what it comes down to until they start accepting more food. And I'm not saying force them to eat, but they've got their favorite foods and that's all they're eating, and some of these kids are on really extremely poor diets. But you have to eat one bite of a healthy food at dinner and start, you have to.
That actually said sleep.
Sleep. This one is sleep. And what was the don't sleep about?
They just don't sleep.
They don't, oh, you're right. Oh, yeah, some of the kids are horrible sleepers, horrible. Meds, and we do behavioral interventions to help with that, and it's a combination, and it is a nightmare. But it does help. We get our kids, usually get them sleeping better over time, if they're not teenagers on their electronics. Okay? Yeah. Yeah, so the combination, behavioral intervention, bed, and meds. Okay? All right? Thank you, guys. Really appreciate it.
Thank you very much, Dr.